So we're looking at the differential diagnosis for excessive bleeding, vomiting in pregnancy. All right, excessive vomiting in pregnancy. So this vomiting is supposed to carry 1T, right? It's supposed to carry 1T. So we said that one of the earliest signs of pregnancy is a missed period, right? Followed by the person is having some 1 or 2 tendencies to like vomit. So we call it what? Excessive, that's nausea and vomiting in pregnancy. All right, Hyperemesis Gravidarum. But this excessive vomiting can be caused by several other things too. So a woman came to you, she's complaining about what? Excessive pregnancy. We're saying excessive vomiting. We're saying in pregnancy because she came to you to say, doctor, I don't know if I'm pregnant. That's always the complaint. But we're now saying if it is not pregnancy, it is what? What could it be? We're just trying to list out possible conditions that could make somebody vomit so much. All right, that sometimes it's not pregnancy, sometimes it's these other conditions. So excessive vomiting during pregnancy, especially when it's severe or persistent, warrants careful evaluation beyond you just thinking it's morning sickness. So sometimes the person is trying to confirm pregnancy. Sometimes the person is pregnant, quite alright, but it's another thing that is even making them vomit. Okay, so other issues could be what? Gastroenteritis. So there's like infection of viruses and bacteria in the stomach, peptic ulcer disease, inflammation of the esophagus, inflammation of the pancreas, biliary disease, fatty liver of the pregnancy, bowel obstruction or paralytic ileus. Okay, then metabolic and endocrine disorders like diabetic ketoacidosis, hyperthyroidism or thyrotoxicosis, right? Hyperparathyroidism. Then for neurological and psychological issues, it could be migraines, it could be vestibular disorders, it could be pseudomotor cerebri, it could be central nervous system tumors, it could be psychological disorders. It's just trying to like show you that you should keep your mind open for any one of these. It could surprise you. You understand that the vomiting is coming from another thing and not pregnancy. So other medical conditions like acute intermittent porphyria, inflammation of the liver, inflammation of the appendix, kidney stones, then preeclampsia. Okay, then sometimes it is side effect of some drugs, or maybe she got exposed to some toxic chemicals, and this one is a side effect. You understand that kind of thing? So clinical cues to differentiate early onset, that's first trimester, suggests pregnancy related causes. But if this occurring in like second trimester, third trimester, it's a strong indication that the issue is from something else. Okay, then associated symptoms, she's having fever, diarrhea, abdominal pain, altered mental status. Of course, it's showing you that there are other issues. They also do lab tests to further confirm a lot of things, So that's just what we have for the differential diagnosis for vomiting in pregnancy. All right, if it is not the pregnancy primary causing it, what else could it be? Okay, so that's it for this.